Hey guys, let's talk about AMAs, against medical advice. This is something that nurses are very familiar with. This document is really a release of liability on the organization. It is mitigating the risks of the organization legally from an outcome that might be bad on the patient when they choose to walk away and leave when they haven't been formally discharged and it's against medical advice for them to leave, but they actually still leave. There's a document that helps formally capture that they have been told this and they're making an informed decision to do it. The ideal situation is that you're going to be able to have this form signed by the patient. But the question is, does a patient actually have to sign an AMA? No, they don't. Does a nurse have to force them to sign it? No, they don't. In fact, we don't force patients to do anything. Patients have a right to leave anytime they want. We always need to remember that patients are there on their own free will. Just because they are admitted does not make them prisoners of the healthcare system. They are autonomous beings. They are self-determining agents, and they can choose at any point in time to walk away and to not participate further in any of their care delivery activities. So just be mindful when we find ourselves in a situation and a patient is doing this, we want to attempt to give them, information so that they're making an informed decision about the risks they're taking on to their medical situation by leaving against medical advice. But where and when a patient chooses to bounce, they can do so. And if they don't sign our precious little document, all I need to go do is document that I attempted it and the patient refused. And you're covered. Here's the thing. Patients refuse care activities all the time. They don't want their linen changed. They don't want to participate in PT. They don't want to get up and take a shower that day. They don't want to go ambulate. They want to refuse that medication. We're there to be partners with them. There's the art of the deal here. We want to help try to influence them and recruit them to participate in the care activities that will help them reach the goal of their care plan, but they can change their mind and do what they want. Here's a caveat. If a patient is cognitively impaired, whether that be from an injury, a pathology, a medication, and in your own prudent assessment, you feel that the decisions they're making are not from someone who has sound mind and reasoning, you want to activate your formal policy on a medical hold, escalate that through the chain of resolution. But at the end of the day, you don't have to make a patient sign